Okay, my name is Chelsea, and I am going to be doing the technique starting an IV mini bag. The first thing that I would do is I would be outside the patient's room and I would check the MAR for the physician's orders, which would establish the type of medication going to be used, the route, and the amount, as well as patient allergies and the patient going to be used. So the first thing I would do is I would gather my supplies and wash my hands. I'm going to be using a 250 milliliter bag of normal saline, and the type of medication used is going to be vancomycin. 500 milligrams is equal to 1 milliliter, so I would draw up 1 milliliter. First I would alcohol swab top. Check the air and draw the medication. Then I would insert the medication into the IV bag and dispose of the needle in the appropriate sharps container. Then I would shake the medication bag and label the bag with the type of medication used, the amount, the date, the patient, as well as my initials and the time. Then I would want to have my tubing. Make sure that it's clamped. And insert. And then I would fill the chamber about halfway full. And I'm going to prime the tubing. So I would release the clamp and make sure that there are no air bubbles. Then I would reclamp, and then this is when I would go into the patient's room. First thing I would do is I would assess the patient using the patient identifiers, make sure that I have the right patient. I would inspect the previous site for any tenderness as well as redness. Then I would apply hand hygiene and wash my hands. And I would also make sure that there are no allergies for the patient. Then I would have a saline flush, and I would use the ASASH method. So I am going to insert this onto the urine, unclamp, and first I would aspirate and check for blood return. There is blood, so we have a good vein. Then using the push stop method, I would insert 3 milliliters of normal saline. Then I would go ahead and take my IV and I would take another alcohol pad and swab this, let it air dry before I inserted it, then insert the IV and lock it. Then I would establish my drop rate, which for this specific medication, the drop rate is going to be 10. So, and then I would check it for 1 minute. Okay, the appropriate drop rate has been established. Then I would assess the patient for any kind of pain or discomfort. I would give them instructions as to calling me if there's any kind of problem. For the next couple hours, I would periodically check on the IV to make sure that it's flowing at the appropriate rate, as well as no problems are with the patient. I would dispose of my gloves and document on the MAR the type of infusion that was given, the medication, the reason, the patient, as well as how they tolerated it, and then continuously document how the patient responds. And also the volume of the medication that was given. Yes.